record this session now. The session will be recorded, and an archived version of this will be made available to the association to be able to put up on their website once this webinar is done, in case you want to go back and review information that we covered today, or perhaps even use it for one of your sales meetings, or to go back and take a look at some ideas that we might cover today. All of you are in the mute mode for the webinar. If you need to ask a question, or you would like to ask a question, or perhaps even discuss something that you have as an idea of a way to generate some revenue or put something together for one of these stakeholders, at the end of the webinar, the last page, I'll have contact information up there for me, both telephone numbers and email address. And I encourage you to reach out directly. I've done a number of these for different various state associations. And what I've found is that a lot of times it's easier to talk specifics if you just call me or reach out to me directly, instead of sticking your hand up in a group situation. So I encourage you to do that. No worries. Feel free to reach out in case you have a problem or you have an opportunity you want to talk about a little bit more in detail. All right, so let's get. I think a lot of you probably saw a little bit about me. I've worked on this particular category for a little over the past year now, from my former position, and then certainly as somebody that's been doing this on my own for the last 5 months or so. And so there's a lot to go through, and a lot of opportunity for you. So let's get started. First off, there's really more that we don't know than what we know. The program is just being laid out. Even when this first year's marketplace window closes, there will still be key discoveries that will be taking place that will guide and determine the future plans of many of the stakeholders we're going to talk about today. So a lot of learning has to take place. So what does that mean for you? You have to be flexible. You have to be alert. You have to be persistent to ensure that you're positioned to take advantage of this process. This is a long-term opportunity, folks. If you're looking at this as just a few months of spending, you're looking at it incorrectly, in my opinion. My sense is that there will likely be more money spent in subsequent years, 2014, 2015, and beyond, that you're going to see spent in 2013. So you have to have a long-term view here, have to have a long-term commitment in order to really maximize your revenue. Several of the revenue streams I'm going to talk about today will likely come to a lot of you as national business. However, as this law rolls out and the opportunities become more visible, local business will become more vibrant. We'll talk about that as this presentation continues. There's a lot of different local stakeholders that you can go talk to now. But don't be discouraged if you're a local seller. Compare this to national advertising, perhaps, that comes to your station, let's say for an automotive brand. Often, you get the tier 2 money, and then, the local dealer money comes in after that. So, keep your eyes open and pursue the local business as it continues to develop. And remember, this isn't a windfall of money, okay? This isn't money that's just going to land in your lap. There's a big opportunity with healthcare reform, but you're going to have to earn it. So there's a lot to do and a lot to learn, but there's a lot to bill if you do that. All right, let's start with the basics of the Affordable Care Act. It's a program being led by Health and Human Services, and it's being executed by CMS, an agency or a division, if you will, of HHS. CMS is the Center for Medicare and Medicaid Services, and they're responsible for rolling out Obamacare across the country. Now, there are a number of regional CMS offices around the United States, but the ACA effort is being originated out of D.C. The program is intended to ensure the health of the uninsured in the United States. That's over 45 million people, of which about 28 or 30 million, depending on the research you look at, will qualify for coverage under the Affordable Care Act. The plan offers subsidized private health insurance for people and families who make up to 400% of federal poverty level. 400% of federal poverty level, folks, for a family of 4 is just north of $92,000 a year. So if you have a family of 4 and you're making under $92,000 a year, odds are you're going to qualify for some sort of subsidy. the additional part of the law is that it's intended to expand Medicaid to cover all the other people who don't qualify for private health insurance. Now, this bill became law in 2010, and it's now obviously entered the activation phase of offering private health insurance to consumers. In April 2013, a Kaiser Family Foundation poll revealed that 42% of all Americans were still unaware that the Affordable Care Act was law. Because you still heard a lot of discussion about having it be repealed or turned down. According to a 2012 report by the Center for Disease Control, about 15% of the United States is uninsured, which, as I said earlier, is about 45 million people. That's in 2012. Of them, about 34 million have been uninsured for more than a year, and 75% of them know very little about the Affordable Care Act. Here's the capper on some of this information. A Kaiser Family Foundation tracking poll in mid-September, that was 2 weeks before the marketplaces were scheduled to open, found 64% of the total public and 74% of the uninsured did not know that the opening date of the insurance marketplaces was October 1st. That was 2 weeks from then. That's 15% and 12% respectively. Okay? So what does that mean? The educational aspect of the law still has a long way to go, right? There's a lot of education that's needed. The Congressional Budget Office and HHS estimated that the first year's goal for getting people signed up for insurance was 7 million people. Now, of them, they need at least 2.7 million young people, let's call them 18 to 35, to be part of that group, and that's by March 31st of 2014. Now, obviously, that leaves a lot of work to do in subsequent years, right? If we're talking about 28 or 30 million people that can qualify for the ACA, first year goal, 7 million. So there's a lot to do in subsequent years. And with the current rate of signups, it looks like it's going to be very difficult to hit the 7 million number by March 31st. So we'll have to see if that date gets extended or how that actually plays out. Now, as the law was designed, every state is to have an insurance marketplace. Okay, they used to call them exchanges, and I use those words still interchangeably, where people can go to purchase health insurance. States could opt to run their own or not. The federal government would like all the states to run their own, but that obviously did not happen. Those that have decided not to run their own will have theirs run by the federal government. Either way, every state will have their own marketplace. Think of it as Travelocity for insurance, where you can see all the competitive offerings at the same time. Now, this has been a political football for a long time, and obviously it continues to be. Many states held off making a commitment to run the marketplace themselves because at first they were hoping that Congress would overturn the law. Then they waited to see if Mitt Romney would get elected president because he was going to overturn it. Then they hoped the Supreme Court would step in and find it unconstitutional. When none of those things happened, that led to where we are today. 18 states plus Washington, D.C. are running their own marketplaces. The federal government has sent hundreds of millions of dollars to the states to set up funding of these marketplaces. These are called state-based marketplaces, or SBM. Now, 7 states have formed a state and federal partnership where both the states and the feds will perform some of this work. And these are called state partnership marketplaces, or SPM. And then 25 states, including Missouri, are called FFM states, or federally facilitated marketplaces, where the federal government will run the state marketplace. And here's a list of the states that are falling into all the different categories that I just discussed. A number of the partnership states, by the way, are interested in becoming state-run marketplaces. Illinois, for instance, has already committed to saying in 2015 they're going to be a state-run marketplace. I think Delaware is on that same track. So you may see some of these move over time. Now, the important dates to remember, obviously the marketplaces had to have been ready for people to access and sign up for insurance on October 1st, although several states and a federal website have had delays in making their marketplaces fully operational as of that date. Insurance coverage will start in January of 2014. That's the first date, January 1st. And the marketplace for this round will close on March 31st, although that date is now in jeopardy, as I said, because of the rough opening of the federal website. Compare this window to the open enrollment period you see for private companies or that unions might use for healthcare. In future years, the window will be open from October to December, and it will only be open for 3 months. This first year, it's open for 6 months, and then in subsequent years, it's designed to only be open for 3 months. Now, at this point, the state-based marketplaces have more money to spend on advertising than the federal states. Take California, for example. California issued a $43 million grant to nonprofits and foundations in that state earlier this year to help with education and community outreach. That's exclusive of the advertising funds that they have of over $86 million over the next 2 years. Now, granted, it's a big state and it has 5 million people eligible for insurance, but that's still a pretty hefty budget. And this money largely comes from the grants from the federal government. It doesn't look like at this point that the federal government is going to have the same kind of money to spend for the FFM states as the state-based marketplaces. However, that doesn't mean that their challenge is any less daunting. Take a look at Texas. Texas is an FFM state, and they have 6 million people uninsured just in Texas, 25% of the state's population. That's a huge challenge in that state. And remember, the feds are running 25 states. Now, Missouri, according to my research from the Kaiser Family Foundation, has about 850,000 people uninsured, or about 14% of its population, which is right about average for the country. Of them, according to the Missouri Department of Social Services, about 300,000 would be covered under Medicaid if the state agreed to expand its Medicaid coverage. However, thus far, Missouri has rejected expansion of Medicaid, but that's something that could change over time. There's a number of states that are leaning one way, leaning another way. This is a sort of a fluid situation. Because of that, though, there are a couple of different revenue opportunities for you in Missouri that I will touch on in a little bit. Now, FFM states do not have a local organization running their marketplace like the state-based or the partnership states do. The actual marketplace where the FFM states and the partnership residents will review and purchase their health insurance will be through the federal portal, which is healthcare.gov. That's the portal for all the federal facilitated states and the partnership states. If you can get on there, and it seems to have gotten better over the last couple of days, if you can get onto that site, you should go on there and familiarize yourself with it since you live in a state where insurance needs to be purchased from the federal site. States like Oregon, California, Colorado, Maryland, the state-based marketplaces, they've created their own organization to run and execute the Affordable Care Act in their states. This includes defining ad budgets from their grant money, picking a local ad agency, executing their marketing plan. The marketing plan outlined and the anticipated costs had to be part of their application to HHS to run their own marketplace. But the FFM states are going to have their advertising and marketing come out of CMS and the assigned ad agencies that they have. You know, the states that are running their own have done a really interesting job of designing advertising that resonates with their own citizens. You know, when you look at Minnesota, Minnesota's a state-based marketplace. They use Paul Bunyan and Babe the Blue Ox for all of their advertising because they found that those iconic figures resonated with the state residents in Minnesota. When you go over to Oregon, Oregon has used folk singers and music and sort of this outdoorsy, back to nature sort of theme because they found that their residents gravitated toward that kind of message. So it'll be interesting to see when the federal advertising starts for the FFM states, and as you know, there's 25 of them. How the messaging will vary geographically, or if it will, from state to state. So one of the questions is, where are the uninsured in the United States? Well, this is a quick little graph that'll show you. 67% of the uninsured people in the United States live in 13 states. If you look at the pie graph on the right here, the red states that I've outlined, California, New York, those two states are running their own marketplaces. Okay, those are state-based marketplaces. The purplish-looking ones, Illinois and Michigan, are partnership states, and all the others, the gray ones, are all federally facilitated marketplaces. So it's kind of interesting to see where the uninsured live, and what kind of a task is ahead of the federal the federal team trying to get the message out. Now, the FFM budgets are conservative compared to the state-run marketplaces. Weber Shandwick, which is the lead agency for CMS, has been awarded $55 million for paid media and digital outreach so far by CMS. Their contract runs through May of 2014, so that's all first-year money. This will be national business for most of you, unless the regional buying firms are assigned, and then that might fall into a local bucket. But for 25 states, with almost half the population not even knowing that the ACA was law just a few months ago, never mind why and how they should become insured, that's not a lot of money, especially considering that 55% of the country's population lives in the FFM states. However, 60% of the uninsured live there. As a comparison, Oregon, which is a state-based marketplace, has about 560,000 uninsured in that state, and they have a $10 million ad budget just for Oregon. All right. So right now, because the federal website is not working right, the paid media from Weber has been delayed. I mean, it only makes sense not to stimulate demand when you can't deliver the product. The feds have said that they'll get the site working right by mid-November, which seems to be getting here in a hurry, doesn't it? So we'll have to wait and see what happens. But the federal government knows it's going to need a lot more help to educate and walk people through their best options with the ACA. They have made, and in my opinion, are likely to continue to make, federal grants to community-based health centers to assist in that process. As part of a $150 million national grant, 22 community health centers in Missouri received $2.9 million from HHS this past July for outreach and enrollment assistance, primarily targeted at the underprivileged. These grants varied from a low of about $60,000 to a high of about $290,000. These groups plan to hire a few more people, and they're planning to help the people who they currently reach out to become insured through the ACA. I would expect this kind of grant funding to continue. So here's an opportunity for you to possibly partner with these organizations by providing ideas and opportunities surrounding their outreach mandate. Now, look, you very well may have to get creative to help them, such as developing civic engagement opportunities, as they may have grant mandates that prevent them from directly buying media. But it's worth reaching out to them to find out. You can find the list of these people that have received these grants on the Health Resources and Services Administration website, which I've listed for you here, hrsa.gov. Go there and search for the $150 million national grant in July, and you'll see the breakdown by state. Take a look at your state, take a look at Missouri, and you'll see the list of people, the businesses who were granted and how much each of them was granted. Another education challenge, many people who are in the target to have health insurance haven't really ever had health insurance. So the educational challenge goes beyond just the Affordable Care Act, but also, how does health insurance work? What's a deductible? What's a copay? What's a network? These folks don't really know. A recent survey done by the Journal of Health Economics showed that only 14% of adults were able to define 4 basic insurance terms like copay and deductible. These people have to make their own purchasing decisions for themselves and their families, and many won't even know what they're looking at. You can imagine, a nightmare scenario of somebody that has bought insurance on the exchange and then has to go into the hospital for some sort of medical procedure or surgery, and is handed a bill where they owe, $9, $10, $12,000, and the person sitting there going, well, wait a minute, I have insurance, but you bought the plan that has a $12,000 out of pocket, and so it's important that people, really get educated, not just about the Affordable Care Act, but also about how health insurance works. Now, HHS Secretary Kathleen Sebelius has said that they will continue to award money to Weber and to others as time goes on as needed. She's also asking private corporations and large foundations for help in funding the outreach necessary to educate people, particularly in FFM states, about the importance of signing up for insurance. For example, Walgreens and the Blue Cross Blue Shield Foundation have recently announced a partnership to help with education efforts. Now, I believe you're going to see more of this private-public type partnership, and of course, they're going to need awareness. So, I think you got to keep an eye out for that, keep attuned to that, see if you find more of those partnerships developing. But I also have to believe that the federal government will fund what's necessary to ensure that the word gets out effectively about this. The delay in getting the federal website working correctly has slowed the education process. There's no doubt about it. It seems like a late start for all the education that's needed as it is. Some states began their social media effort in the spring, but the primary reason most didn't get started that early, even though there's a ton of education needed and questions to be answered, is that they wanted to make sure that the marketplace websites were up and running when the advertising started. When the ads run, people become curious. Advertising works, go figure. And if they don't have anywhere to go or any place to go get their questions answered, the thinking was that they'd become disenfranchised and, maybe get turned off to the process. The ads will have a call to action to find out more information. So it's better to wait and make sure the websites are working before the advertising starts. They have to get the federal website running right for a number of reasons. But the mid-November to mid-December timeframe is really important because that's the latest people can sign up for their insurance to start January 1st. It takes a couple of weeks for your application to go through the process and get approved, and then your insurance coverage begins the first of the following month after you're approved. If the website isn't working right shortly, watch for conversations about extending the March 31st deadline or delaying the personal fines for not having coverage. As I said, there's a lot of education and information that's needed. People will have a ton of questions that the websites won't sufficiently answer. Some of the insurers are trying to help educate as well, and we'll talk about them in a minute. But the feds have the same problem as the states, only more complicated, since they have so many states that they're responsible for, and as I said, not a lot of money. All the FFM state marketplaces will go through the same portal. This required the soliciting, reviewing, and selecting the insurers to be included in each state's marketplace. This is the slide that I got when I tried to sign on. The states had to solicit and review their insurance companies, and then those selections had to go to the feds for their review and approval. There are 3 insurance companies that will compete on the individual market in Missouri this first year, from what I've seen. Remember, this list can change year to year. Some of these plans may only be offered in sections of the state, so again, it's another good reason for you to get on and take a look and see where they're offered. Some state-run marketplaces have announced that they're also delaying complete public access to their online marketplace. A number of them have delayed access to part of their sites. Some have delayed the access to the Spanish language side, which is a key component to making this work. Some have delayed the small business side. So far, the insurance companies have reported that really only 4 states, Colorado, Kentucky, Nevada, and Washington State, have marketplaces delivering the data that the insurers feel is accurate. Now, the federal site has been weighed down not only from opening day because of the traffic, but also the discovery of much deeper software problems. They delayed the Spanish version of the website, and that's been delayed indefinitely now, and the small business section was scheduled to open just a few days ago. Obviously, the feds are working overtime to get this site working correctly, but only time will tell how this will play out. If you take a look at this little pie chart here, you take a look at the third item from the top, 3.72. This is the first week the websites were open. This is just the federal websites, the healthcare.gov. 3.72 million people attempted to register, and then the bottom line is 36,000 completed their enrollment. So very, very small percentage. They wanted to have 500,000 people signed up by the end of October. And according to the Washington Post, they didn't even get a third of the way there. As of October 30th, to give you as an example, Colorado, which is one of the states that is reportedly working very well, had 44,000 accounts created, but only 3,164 enrollments. So clearly, there's a lot of pressure to get this back on track and get this thing working correctly. So with so much education that's needed and not a lot of money to spread around the FFM states for that purpose, what can you do to earn more attention and a bigger share when the buys for the exchange come down? If you know the challenges that the exchange is facing, maybe you can create elements that are meaningful and valuable and get you noticed. It's going to be impossible, in my opinion, to get all of this information out with 30 and 60-second spots. So what else can you do? Can you get beyond the spot buy? Can you develop news and information segments that are valuable and that could potentially be sponsored? Can you create civic engagement events that you can bring people out to hold meetings, with members of your community to try to educate them in a big way? Maybe create telethon-like opportunities. Maybe long-form infomercial style, long-form blocks are available. What about web products? We have to use the digital media here. This is a web-based product after all. So are there web are there opt-in opportunities for mobile communities that you've created that perhaps you can leverage? Can you create informational pages on your websites that can have long form information? People are going to need long form opportunities to get answers to their questions. If you can provide some of that, that should deserve more attention. Remember, the FFM states are going to be relatively small as of now, so they'll be looking for a lot of value added, a lot of earned media. My recommendation would be anticipate their needs and be prepared to deliver above and beyond the avail so that you get your share. Now, there's a few other ways for you to help develop this. With as much education that's needed, one organization that is planning to play a big role in helping educate consumers about health insurance and the Affordable Care Act is a nonprofit organization called Enroll America. It's run by former Obama White House operatives, and many others are involved in its leadership as well. They're receiving funding from insurance companies, big foundations, trade associations, unions, and others to fund an educational campaign around healthcare reform in addition to providing best practice guidance for state-based marketplaces. They expect to launch a $100 million campaign to help educate people about healthcare reform. Now, some paid media I know has already been placed in some states, both in English and Spanish, and in other states they've already opened field offices to put some boots on the ground to work in communities to spread the word and educate people. In addition, they may be active in states that are not expanding Medicaid. We mentioned this earlier, to try to build public sentiment to get the state to expand it. Now, obviously, that would be a long-term effort on their part and go well beyond just the windows of opportunity that we have to enroll in health insurance. But nonetheless, you need to get yourself familiar with Enroll America. They look like they're going to be a player for a long time going forward. Another area where I think you can prospect is the independent insurance brokers. They're going to play a big role in helping people get signed up for healthcare. Although they're prevented from being navigators per se by law, they can still guide people through the process and help them make good decisions about what plan is best for them and about the details of those offerings. This is a good developing category for local businesses, for local sales. The bigger brokerages may see this as an opportunity, as a way to invite people to do business with them, because they can present not only the products that are in the exchanges, but also the products outside the exchanges. I encourage you to talk to the bigger brokers in your market and see how they look at this opportunity. Remember, they're selling health insurance, but they're also selling other kinds of insurance. So this might be a good way for them to bring people under their tent, get them to help sell the health insurance, but then home insurance, life insurance, car insurance, all the others that they may also represent. There may be some desire for them to brand themselves in your marketplace so they stand out in a field that is largely viewed as a commodity type business. Another area are called navigators. The feds know that they're going to need help with people being capable of answering questions, both at the state-based level and at the federal facilitated level. They originally created a $54 million grant for a role they call navigators. These are people who will be trained to help consumers navigate their way through the system and get signed up for health insurance. The grants were announced middle of August, and in fact, CMS funded $67 million to over 100 organizations. The grant winners may need to recruit some people depending on what they need. Again, these are local organizations. At least one organization in each state must be a community-based organization. And as I said just a moment ago, they can't be insurance brokers. And in fact, in some states, I know that there were some organizations forming specifically to become navigator businesses. The early feedback is that the navigators have been very important to the process, but there aren't enough of them. So this may be a developing opportunity that you're going to want to stay on top of. It may result in additional funding and having the navigator element, the navigator education arm, become bigger. Now, in Missouri, there were two organizations that were granted $1.8 million as navigator organizations. Primaris Healthcare Business Solutions received just over $1 million, and the Missouri Alliance of Area Agencies on Aging received about $750,000. If either of these organizations in your markets, you should contact them and see if you can partner with them. But I do offer you this word of caution. These grants specify that the grant money cannot be used to purchase media. And so far, there hasn't been much partnering with navigators by media, no matter what state or who granted the funds. But these are good resources for you. You'll need to be creative in how you partner with these organizations, but you need to have a relationship with them. And the reason I say that is, let's say you wanted to create a civic engagement opportunity, and you wanted to bring a lot of people together so that the exchanges perhaps could make a presentation and have this sponsored by insurance companies or other stakeholders in healthcare reform. You're going to need people that can answer questions. These folks here, the navigators, may be able to help you with that. So for more specific information, go to cms.gov, and search in the little search box in the upper right, Navigator Grants. You'll find out more about each of these organizations. Another way consumers will get information is through call centers. The state-based marketplaces have created them, and the feds have a centralized call center. They employ a good number of people on all of these, as many who want to sign up through the exchange are calling them and having their questions answered. Again, we may see this service grow. There are federal call centers now, but they may extend that because I think they're finding out that these are pretty valuable. I know that some states that have their own state-based marketplaces created call centers, and there was some money spent for recruiting people to work there. So, again, keep in tune to this. If this grows, there may be some recruitment help that you could offer the call centers. Now, let's talk about the insurance companies for a moment. When I first started looking at this law and its opportunities, my first thought was, man, the insurance companies were going to go crazy trying to gather as many new subscribers as they could. I mean, after all, 45 million new prospects with about 30 million who could qualify under the Affordable Care Act, and the government was going to pay the premiums for a lot of them? What could be the downside, really? Well, we really haven't seen a tremendous land rush, have we, from the big national health insurers yet, aggressively pursuing new subscribers. And mainly, based on what they've told me, it's because they don't know what to expect. We've never gone down this road before, and the big insurers aren't sure really what's going to happen. Remember, most of these people who are signing up for subsidized health care haven't had ongoing health care for a long time. So there's no history, there's no risk mitigation on covering them. Remember, with the Affordable Care Act, insurers can't charge a higher premium to people who are sick more often. They can't deny coverage. They can't exclude pre-existing conditions. So insurance companies need to learn more about how this is going to work before they're able to put together plans that they're confident with about expanding their offerings. That said, there may be new competitors coming into your marketplace as time passes. CMS has funded the startup costs of 23 new health insurance co-ops in 24 states with low-cost loans. These are new businesses that want to join in on the exchange and join in on this opportunity. So what does that mean? Competition is going to increase. And of course, the new insurance companies will need branding and awareness. As of now, there are no new co-ops funded in the state of Missouri. However, there may be more co-ops coming down the line, so you're going to want to keep track of that. But as of right now, the funding from CMS for these new health insurance co-ops has been put on hold. I would not be surprised to see some sort of funding mechanism return, as there's a lot of interest around the country from many more startups wanting to get involved in the exchange. And if we continue to see insurance companies holding off and getting into the exchange, that could be the impetus to getting this funding restarted. We'll have to wait and see, but these new companies certainly are going to need branding, and they're going to need awareness in a hurry. As I mentioned earlier, Missouri has 3 insurance companies competing on their individual exchange. Anthem Blue Cross Blue Shield of Missouri, and Coventry. The exact costs of each company that they're going to charge are now listed on the healthcare.gov website. So again, you'll want to see how they compare. In many states, it's not a surprise that we see some of the bigger names in health and healthcare insurance staying on the sidelines. Blue Cross Blue Shield has been active in many states. Aetna has been fairly aggressive in offering plans around the country, but United Healthcare, the nation's largest health insurance company, isn't participating in any exchange in any state. In fact, in California, 3 of the largest health insurers in the nation, United Healthcare, Aetna, and Cigna, have all opted out of that state's marketplace for the first year. Now, they don't have a big footprint in California for individual plans as it is, but they've taken a wait-and-see attitude with the second largest uninsured state in the United States. Like most people, Missouri residents largely get their health insurance from their employer, with about 50% doing so. Through Medicare, Medicaid, and the VA, another 29% of Missourians are covered with health insurance. So only 6% of the state's residents currently buy health insurance on the individual market. So many health insurance companies aren't active and aggressive in this market, primarily because it's pretty small. But studies predict that that number is going to double by 2017. That's why we see a lot of a very cautious approach from many of the large national health insurers right now as they try to figure out how this will work. Like I said, you'll want to stay close to which insurers in your state are participating and which may join in the exchange next year. Remember, most of the insurance that we see now in media with advertising focuses on casualty insurance. That's home, auto, and life. That would be your Progressive and your Geico and State Farm, etc. Not many aggressively pursue the individual health insurance market, so that's another part of this that the insurers are trying to learn, how to market that product. Even though several big national health insurers are not participating in many state exchanges, some have made a big commitment to educating people about the importance of health insurance and how it works, with a lot of that being taking place on their websites. Plus, remember, just because a company isn't listed on the exchange doesn't mean that they don't offer individual health policies. You may be able to buy coverage as an individual from a company not on the exchange. The only difference would be you just wouldn't qualify for a subsidy. Here in Iowa, where I am, the largest individual health insurer by far is Wellmark Blue Cross Blue Shield, and they are not participating in the exchange this year, but they still sell the vast majority of individual policies. So go to the insurance company's websites and take a look and see what they're doing from an educational standpoint about how health insurance works and why it's important to health insurance. There may be an opportunity for you to do something with them on that level. Remember, there will be years of signups. This is just the first. Once insurers determine how this changes their business model, and they believe they can compete effectively, I believe you'll see more aggressive insurance advertising and more companies becoming listed in the exchanges. Another point to remember, people can change their coverage in a year during the open enrollment. So it's not a one and done kind of buying. I mean, if you go on there and you buy your insurance this year and you discover, boy, I really don't like the network that I'm in, I don't like the way this company works as far as feedback that I'm getting, you can change when the insurance window opens again. I believe you'll see more companies enter into states where they only have a marginal exposure now as their opportunity becomes clearer. That's why I said early on that there very well may be more money spent in subsequent years than in the first year, even though there's a tremendous amount of education needed right now. Once the insurers get more aggressive, I believe there'll be more marketing money spent by the insurance companies. Insurance spending may be local, maybe national, depending on where it originates. But if more local new insurers are created, and there may be, depending on how these first ones do and whether the CMS funding continues to be available for low cost loans, obviously those will likely be local or regional accounts, and they're going to need a lot of awareness and, of course, subscribers. Now, the healthcare provider side of the business is another part that is going through a substantial change, and there'll be a lot of opinions around on how that business is going to look 5 years from now. The Affordable Care Act will reward them for better outcomes. So that's a big deal right now. It's a different compensation model for healthcare providers versus the fee-for-service model now. They're working on how they can measure those outcomes and how they'll manage patients to ensure that they get good outcomes. That's a big paradigm shift, and they're still trying to anticipate what that'll mean for them. They're creating what's called accountable care organizations, which is a term you're going to hear more and more about. This is going to change the relationship between the providers and the insurers. At least that's what they tell me. It's going to become more aligned. And in some states and cities, it's happening right now. And needless to say, these organizations are going to need branding and they're going to need marketing to build that brand and to define how this is different. The providers, I believe, are another big opportunity for you to grow local revenue. This is a very competitive category, and it's going to be more competitive still. Local hospitals are expanding services, including opening a lot of satellite offices that'll need awareness. With so many more people coming into insured care, they have to expand their capacity to be able to handle that. I believe you'll see some consolidation in this space as smaller operators join together in order to be more competitive with larger medical centers. We're actually seeing that start to happen in some markets now. If that happens, you know they'll need branding and marketing. One thing that's driving the expansion and the competitiveness of healthcare providers is that there's a lot more transparency now than ever regarding doctors and hospitals and outcomes. I mean, you can see infection rates at hospitals. You know, there are organizations that rate hospitals based on infection rates. You can see which facility is ranked highest for certain procedures. There's more self-directed care now between patients and doctors. So the hospitals know that strong branding and messaging is a way to keep them on top of patients' minds. And this is only going to get bigger and bigger. The self-directed care, meaning, if you need to have a knee replaced and your doctor says, hey, we're going to go to Dave General and have your knee replaced, and you look up and you go, boy, Dave General does not rank very, very highly when it comes to orthopedic joint replacement, but Burke Medical is clearly a top shelf hospital for that. The self-directed care is the patient going to the doctor saying, I want to go to Burke Medical. You take me there and get this done. This is becoming bigger and bigger, and it's something that will continue to grow. So you need to have relationships with the marketing directors at all the big medical centers and be ready to provide them with good ideas on how to expand their brand and which areas of medicine they really want to be known for. Do they want to be known as the heart hospital? Do they want to be known for women's care? Maybe they want to be known for their cancer center or their emergency room services. Something like that is something that is a great conversation to have with the marketing directors at hospitals. Another area of healthcare providers that is going to undergo a lot of change are the mental health providers. This is the psychiatrists and therapists and counselors and the like. These professions have by and large been independent of the corporate healthcare system and have not participated in many health insurance plans versus their medical brethren. And if there was coverage through a person's insurance, it usually was at a much different level than the medical coverage. Well, all that is going to change under the Affordable Care Act. All health care plans now must include mental health coverage, inpatient and outpatient, and it must be covered at the same degree of copays and deductibles as the medical coverage. This will take some time to develop, but I believe you can anticipate consolidation in the mental health space. leading to bigger centers, as well as a close alignment between mental health providers and the bigger health systems. Keep an eye on this area. This is a developing situation, but it appears that it could be on the brink of tremendous change and could be an opportunity for you. Community health centers, or those that do a lot of work with Medicare patients, is also an opportunity for you. These folks are facing a real challenge. The Affordable Care Act will reduce the reimbursements over the next decade, with the understanding, the Medicare reimbursements, with the understanding that most of the Medicare patients now will be able to qualify for subsidized private health insurance. The balance of that is for the states to expand Medicaid to include those that are under the 138% federal poverty level, which is the cutoff for the Affordable Care Act. The federal government said they'll pay 100% of the cost of that care for the first 3 years and then 90% in subsequent years. But the Supreme Court said it was up to the states to decide if they wanted to do this, and the federal government couldn't force them to if they didn't want to. So the states that have decided not to expand Medicaid, and there are 16 of them, including Missouri, means those that are under 138% of federal poverty level may fall through the cracks. The smaller and medium-sized community health centers may be in a tight spot here because they really depend on Medicare reimbursements for a lot of their operational funding. Now, if their state doesn't expand their coverage, a lot of their current patients, which are Medicare patients, will have private subsidized health insurance going forward, and they may decide to go to other hospitals which take that insurance. So you can see how this might be a challenge to them. They stand to lose their Medicare patients, and there's not any Medicaid patients in the pipeline to take their place. So you may see community hospital marketing, you may see community health center consolidation in the future as they try to figure out how to redefine their business model going forward and develop a new way of doing business based on what this current set of circumstances has presented to them. It's a good category for you to prospect and diagnose as they learn how their business is going to try to evolve going forward. They very well may need your help, and so I encourage you to go talk to them. One area of healthcare providers that I believe you're going to see grow very quickly is the urgent care business. The healthcare delivery in this country will change because of this law. You're starting to see it now. There's really more retail medicine that'll take care of a lot of routine medical needs for consumers. So this is a very good category to prospect. You're starting to see some chains and some franchises emerge, and it will become very competitive. In Missouri, you have a number of Minute clinics that are inside of CVS stores. Walgreens also has many Take Care clinics already open in the state. And you should watch for Target to open in-store clinics as well. They're in a few states. They're not in Missouri yet, but I believe their plan is to continue to expand. For urgent care, Concentra is in many states and it has clinics in Missouri already, as is Doctors Express, the Urgency Room, Family Medical Clinics, and many other urgent care clinics and standalones that I haven't mentioned. These centers are going to serve an important aspect of the healthcare delivery as they take a lot of pressure off the emergency rooms and the business that, according to the medical professionals I've spoken with, is better left outside of the hospital environment. So when Johnny gets the sniffles, you can take him to an urgent care place, get him taken care of. No need to go to the emergency room for the hospital. As such, I believe you can expect to see insurance companies become very interested in this business going forward, and I would not be surprised to see insurers get into this business at some point. But right now, my recommendation for pursuing healthcare providers is, one, pursue the urgent care businesses aggressively, and two, create relationships at doctor groups, hospitals, community health centers to monitor what they're experiencing. They're going to learn a lot in a short amount of time, and hopefully you'll be in a position to learn too. Then you can find ways to help them. I expect this space to become more competitive, and with the need for positioning and branding increasing as the competition increases. Remember, there's going to be a lot more people who can use their services. Now, with all those people that are going to become insured, one of the questions I have is, who's going to provide all that care? So here's another revenue stream that I believe will grow substantially. and that is the schools that will provide the training for people who are going to administer care. According to the research I've read, with so many physicians approaching retirement age compared to those entering the system, the United States might be short as many as 30,000 MDs within the next 10 years. Now, this gets back to the urgent care model, right? Where medical services are given without having to see an MD for everything. I think it makes a lot of sense. So the people besides the doctors that are going to be greatly needed will be the registered nurses, the practical nurses, the physician's assistants, and the like. There's going to be a huge need for these professions, and their schooling takes time. So they need to start right now to get through the next 18 months or 24 months or however long it takes to get through so that they can start to work in this field. The challenge with nursing schools isn't that there hasn't been a lack of students, but there's been a lack of teachers. So maybe retirees can be recruited as teachers. I'm not sure. But with a glaring need like this, there has to be an opportunity. That would be a category that I would go deep into right now and find out where you can help. This need is going to persist, and I believe you're going to see this category grow pretty substantially. We're going to need pharmacy technicians. The pharmacists are going to play a bigger role in helping keep people well, because wellness is a big deal. And pharmacists are going to be a go-to person that a lot of people on the retail side are going to reach out to. Dental assistants. Remember, as part of the Affordable Care Act now, pediatric dental has to be part of your insurance. Your kids have to have dental care. Adults is sort of a voluntary part. The kids are not. So we're going to need more. We're going to need more dental people, more dental professionals, because we're going to have a lot of people with dental coverage. Physicians' assistants, medical billing, emergency medical techs, licensed practical nurses, home health care. If we're talking about outcomes and follow up, who's going to do that work? All of these categories, I believe, are going to grow. So get to the schools now and see where they are. Talk to the schools that don't even offer these programs and see if they intend to. I mean, if we see the need, you got to believe so do they. So get ahead of the curve and get into the schools. Now, as we discussed, there's a tremendous amount of education needed, and the government isn't going to be able to do it alone. We've talked about Enroll America, a 5013C that's going to do a lot of funding, going to be funding a lot of messaging, rather, about the Affordable Care Act and perhaps about expanding Medicaid. But there are other nonprofits and foundations that you can prospect as well. Many have a focus on healthcare. Some of these receive grants from other big foundations or from the government to help them do their work. For example, earlier this year, the federal government awarded $32 million in grants to foundations for education surrounding the importance of having kids get health care coverage. In Missouri, the Legal Services of Eastern Missouri received a $380,000 grant from that particular round of grants from the federal government. Larger foundations in some states actually even fund smaller foundations who then go into the marketplaces and into the communities and spend the money. It can be a challenge to uncover these because the only way to really discover them is talking to them. But it's a worthy pursuit. Use the library, use online, use government listings of nonprofits and other resources to create a prospect list of foundations. You may be able to identify which ones actually have a healthcare focus just from your research. Now, not all have money to spend, not all have a desire to partner with you, but it's something worth looking at. Some may have a need and money, but they're not sure what to do. You can create a way to help them, and then you'll both benefit. Okay, 2 additional points when it comes to this. First, don't overlook hospitals. Many have in-house foundations that deserve a look. Maybe they have something that they need that you can help them with. Secondly, as I said earlier, keep an actively managed list of the prospects and where it leads. It can become confusing because one foundation may actually fund another. And I don't want you to miss an opportunity. So you'll have to really keep on it and manage that process. But it's something worth pursuing because there could be some money there. Now, you're going to uncover opportunities as this law gets rolling that we haven't even talked about. For instance, one that will get, I believe, be pretty substantial will be the political action money being spent by groups talking about both sides of the Affordable Care Act, the good side and the bad side. The Democrats could use Organizing for Action or one of their other PACs. The GOP has Americans for Prosperity and Generation Opportunity. You'll want to keep your finger on the pulse of this to see where the money is as this rolls along. My sense is that there's going to be even more available next year as the midterm election cycle gets ramped up. And remember, if we have elections in November, the next window is going to be October to December. It's going to be right in the middle of it. Also, don't discount the importance of your digital offerings and your social media outreach. As I said earlier, wellness is going to be a big deal going forward, and social media is going to play a bigger role. According to the Journal of Internet Medical Research, 60% of adults surveyed use the internet to find health information, 60, but only 15% actually engage in social media to discuss health information with their peers. That's a big gap, and I believe you're going to see that close. I had a conversation recently with a healthcare marketer in the Northeast, and she believes that social media and digital outreach are going to be critical to the success of healthcare reform. This brings me to the most important and yet hardest to connect with demo to convert for this, and that's the young invincibles. These are young, healthy adults, 18 to 35 years old. A lot of them don't feel like they need health insurance. So they'll just pay the penalty. Remember, every year you don't have health insurance as a penalty. It escalates year after year. But these people will pay the penalty and go without. And largely, they really haven't been paying attention to the law. A Commonwealth Fund study in late August found a whopping 73% of 19 to 29-year-olds were unaware that the insurance marketplaces were going to open on October 1st. I mean, that was 6 weeks from when it was going to open. And 3/4 of them didn't know. Why? Likely they really weren't paying attention. It wasn't that important to them. So social and digital media are going to be critical in engaging this segment of the population and getting them involved with the Affordable Care Act. With all the different opinions flying around and efforts that are being made to sway people one way or another regarding the Affordable Care Act, when it comes to the young invincibles, the people they'll trust most very well may be each other. So you can see how social media might be an important tool when communicating to these consumers. In Massachusetts, the Romney Care people, the Massachusetts Connector, they used Red Sox players when they rolled out their project years ago to talk to young invincibles. That's another good idea, by the way. If you have access to people who resonate with this demo, musicians, sports figures, celebrities, that could be an important element for the exchange and earn you more share. Remember, the advertising is going to include paid media and digital outreach. So it's vital that these healthy young people sign up for insurance, as it will balance the scale of coverage against those older and more ill. If they don't sign up, the balance will tilt and the insurance rates will go up in a hurry. HHS says they need 2.7 million younger people to sign up the first year to keep the pool balanced if they get to the 7 million people mark that they hope to get to. This is one part of the Affordable Care Act that, if it doesn't work right, it could drive the whole thing off the tracks. And as you know, the young invincibles live online. So, excuse me, as you develop ideas and strategies for these stakeholders, keep in mind the importance of attracting this demographic and how you can offer ways to reach those who they believe will be the hardest to reach. This is a big issue. If you can find ways to connect with these invincibles, you could get more clearly on the radar. For example, HHS is holding a consumer-generated video contest by and for young people to get their message across. Take a look around and see what's happening across the country. See what others are doing to try to engage this demographic, and then see what you can do to help that as well. Nielsen says 92% of major influences in our lives are from people we know, which really isn't surprising. So you can see the potential for big social media impact. I believe that's going to happen over time, and you might be able to have a role in getting the conversation started, or at least point people to where the conversation is happening. Remember, all these marketplaces are going to be online, and they are online, so it makes sense that online be a vehicle for this. Feedback, reviews, guidance, peer-to-peer discussions. I mean, I think Yelp for healthcare, right? Can you imagine that? That very well may be in our future. So as you can see, there's a lot of education needed on the consumer front, both for the consumers and on the stakeholder front, as everybody learns how this is going to affect them. It's going to be a formidable challenge to get all the information out to everybody who needs it. It's my belief that anytime you're dealing with people's health or people's money, and this does both, a lot of explanation is needed. Even with a lot of spots, there's so much more education that's needed that can fit into a 30 or 60-second window. So if you know what the challenges are and you know what they are, you can work to overcome some of those and develop ideas and strategies that will help the marketplace in your state. It's not unlike any other category in that regard, is it? What are the challenges? Where are the pain points? What can we do to help them overcome those? But if you don't understand the category and their challenges, you won't be able to fix them. So let's summarize some of the more action items that we talked about today. All right, when it comes to the marketplaces, how can you get them in front of a lot of people? They need to talk to a lot of people. Can you provide them that opportunity? What long form opportunities on air can you provide to them? Can you develop content, on air content that they may want to ride onto? What about web content or digital strategies to meet their needs? Are there things that you can do with your texting community? Are there things that you can do with your websites? When it comes to the insurance companies, look for new companies that are being created. Missouri hasn't had any yet, but 24 states have. Create relationships with all the big insurers, because the insurance companies on the exchanges are going to change over time. Plus, if there are insurance companies off the exchanges selling policies, they're going to need people to know that they can shop for them too, providing they're not looking for subsidies. Look for new relationships that insurance companies have with healthcare providers. These accountable care organizations are going to provide or create new relationships, and talk to the brokers in your marketplace about how to increase their role in this process. When it comes to healthcare providers, prospect the urgent care, the retail medicine space. That's going to become very competitive. Meet with the marketers of the hospitals. Talk about competition. They track this pretty closely. You'd be surprised when you talk to marketers. They're pretty aware of what their market shares are in a lot of different ways. Talk to them. Find out how you can help them. Discuss the new insurance provider networks that may be being created that may need awareness. And then get in front of the community health centers. Remember that their business model is changing, particularly in a state like yours where Medicaid is not expanding. And keep an eye on the mental health providers too, because you're going to see a change happen with those particular providers. Schools, look for medical courses, new and existing. Go talk to the schools, see if they're going to get into it. The schools that are already offering it, are they expanding their offerings to meet the need that's going to happen in this country? Stay aware of foundations. Enroll America. Stay on top of them. They're going to be a player for a long time. Stay diligent with that. Dig into the local market to see if there are more healthcare-oriented nonprofits that you might be able to go talk to and partner with. There may be an opportunity there. Follow the grant process from the federal government. As I said, as a word of caution, you have to be creative. A lot of times these grants specifically say you cannot buy media, but go ahead and talk to these people and see if there are opportunities to partner with them, to maybe use them as a resource to develop revenue opportunities. Dive into the Navigator recipients also if they're in your marketplace. See if you can do the same thing there. And the political action committees, of course, pro and con, keep on top of them for political spending. You're going to start to see that come to fruition as well. And always keep in mind the young invincibles. This is a key element to all of these different stakeholders we just covered. And so you're going to want to keep in mind how to develop ways to reach out and connect with those consumers. Some of these opportunities are pretty clear cut. Others are still developing. Some are evolving. And a lot of them are very confusing. It's a chaotic category, I grant you. But often where there's chaos, there's opportunity. 48% of the public said they don't have enough information about healthcare reform to understand how it will impact their family, according to the Kaiser Family Foundation. I don't know if that number has moved, quite frankly, since this poll was taken this past summer. As someone said, we're not even in the first inning of the Affordable Care Act yet. The national anthem has just been sung. So be diligent on how this evolves. Anticipate the needs of the stakeholders. Create ways to help them meet their challenges. I believe this can be one of your biggest revenue categories going forward. And I hope that by reviewing this category with you today, you have a little bit more knowledge and a little bit more confidence to immerse yourself in the opportunities that this presents. Because the more you know, the more you'll get. Now, here's my contact information for you, as I promised at the beginning. If you need to reach out, if you would like to reach out and talk to me specifically about different things that maybe you have going, or ways that you are thinking about reaching out and trying to build opportunities for your stations, I'd be happy to hear from you. Drop me an email. That's probably the easiest way to reach me. I travel an awful lot, and so that might be the best way to do it. But also, here's my cell phone and my office phone numbers, and I'd be happy to hear from any of you. So I appreciate you joining us today. Thanks again to the Missouri Association of Broadcasters and that fine organization for sponsoring this. Uh, I have recorded this session. I have to convert it and put it into a format, and then I will forward it to the association for their use, and so you have an archived version of this that you could refer back to over time. So I thank you. That'll end today's webinar. Thank you all for joining us today. I hope you found it to be worthwhile.